Good evening and welcome to Live United. Live United is a show where we highlight different efforts in the Monadnock region that are contributing to the well-being of individuals who live here. Today I'm joined by Susan Ashworth. Susan is the Director of Community Relations for Home Health Care, Hospice, and Community Services. And today, Susan's joining us to talk specifically about transportation and some of the transportation services offered through HCS. So welcome, Susan.
Thank you, Kelly.
It's nice to have you here. You know, transportation's always kind of a hot issue here in the Monadnock region. People see vans running, they see buses running, and they're not quite sure how it all works together. So tell us a little bit about the services provided. You know, services like Friendly Bus. Let's start with Friendly Bus, and so services offered through HCS.
Well, HCS does provide a number of transportation services, and we really feel that mobility is key to independence, so the services do tie into our mission as an organization. And we have a number of transportation services. The one that we've been running since the early 70s is the Friendly Bus. And the Friendly Bus is for seniors over the age of 60 to have access to any activity of daily living within the city of Keene. So, for instance, if someone needs to go grocery shopping or get prescriptions at a pharmacy or get to a medical appointment, then they can call a Friendly Bus one day in advance and we'll be able to pick them up at their doorstep and get them safely to their destination and back.
You know, what a unique service when you think about long-term care and people really trying to stay in their own homes now. That you know, it's not affordable necessarily to always go into long-term care, and really having that independence and being able to live at home, but maybe not being able to get to those places that they need to go for service. So something like the Friendly Bus, what a unique service. Now, does it also provide for people with disabilities at all?
It does. All of our vehicles have wheelchair lifts and are completely ADA compliant. The most important thing to note, though, is that our drivers are very well trained in passenger assistance techniques, so they actually get down from the bus and help people off and on, so that it can be a very safe journey for someone who has an assistive device, or if they have a walker or wheelchair and they need to use the lift, the driver will assist with that also to make sure they are boarding safely and secured safely in the bus.
What's the typical ridership in the course of a year on something like the Friendly Bus?
The Friendly Bus is providing about 10,000 trips a year to senior citizens, and we're very pleased that through our outreach efforts, we're just starting to go to some of the elder housing units that are outside of the city of Keene. So, for instance, today we're going to Swansea, picking seniors up and taking them to a grocery shopping excursion. Again, trying to give people more access to services that they can help stay in their own home.
So that sounds like you've organized almost a group kind of trip for people, that you've notified them. Did you notify them that you'll be out at the housing facility?
Yes, we actually went to some of the senior housing in the area and talked with them about what they wanted for a service. And through a discussion with those residents, we came up with a shopping trip. So we're trying it to see if we can get enough people who are interested. On the shopping trips, the driver does help with packages. So this is a very important point for people who are going grocery shopping and maybe the milk and everything is very heavy. To get into the house, we will bring packages to the door of the person's home where they can then get them safely stowed in their refrigerator. And again, it's just a comfort to know that there's somebody there assisting you with your transportation.
You know, it's a really nice service because in my former position, I worked in the substance abuse realm. And when we worked with the elderly, one of the things they told us was that oftentimes they had to rely on other people to go pick up their prescriptions for them, and sometimes those prescriptions were diverted, and they then didn't receive the medication that they needed. And having that kind of door-to-door service that really allows them to take responsibility for their own well-being, what a nice thing. Now, you mentioned that there's other transportation services that you're offering. Can you talk a little bit about that?
Yes. We also operate the City Express, which is public transportation in the city of Keene. So that's for people of any age. About half our riders are under the age of 60 right now. And we do run 3 buses during the Keene State year. We also operate the Keene State Shuttle. But most of the time we're running 2 buses throughout the city in a fixed route. They're looping the city, and people can get on at one of our bus stops and get to their destination along the route. If a person is disabled, we operate the Para Express. So we will go within 3/4 of a mile of that route to get somebody who can't get to a bus stop and has a transit disability. But for instance, we stop at Cleveland Building and East Side Housing and Central Square Terrace, Stone Arch Village, and we stop there about 14 times a day with our vehicles. People can get on for a fare and get to their destination. So it might be grocery shopping, it might be to Cheshire Medical Center, or really anything that's on the route.
So that route does run out to the hospital and loops back around to those other locations that you mentioned?
It does. It starts here in downtown Keene, goes to a number of different high-density housing in the downtown area, goes to the Keene Rec Center, then up to Cheshire Medical Center, across the 5-mile drive. So if someone wants to visit a relative in, say, Genesis Nursing Home, or needs to go out to Cedar Crest, or is working at any of those businesses along Maple Avenue, we are going by that direction. Then we come down Park Avenue and to a lot of the retail and shopping plazas along West Street, and swing over to Riverside Plaza, and then we're back in downtown Keene, all within an hour. So,
and you mentioned there's a fare for this. What is the cost for somebody to ride that bus system?
it's $1 a ride, but we do have very affordable options. We have 10 rides for $7 and an unlimited pass for 30 days for $18. For students between the age of 12 and 16 over the summer, we're running a summer fun pass, and that's $10 for unlimited rides for children in that age bracket, because they don't have to rely on their parents. They can hop on the bus and get out to Wheelock Park, or get out to wherever they would like to go to visit a friend, to visit grandma. Children can certainly safely ride the bus because there's a very well-trained driver on that vehicle.
So we have the Friendly Bus, we have the City Express, Friendly Bus servicing primarily the elderly, it sounds like, or people with disabilities, wheelchair accessibility. Now, does the City Express also have wheelchair accessibility?
Yes, it does. All of the vehicles are ADA compliant, and they do have lifts. So if someone lives along the route and does have an assistive device, they can get on that vehicle and get where they need to go. Lots of people like to ride the City Express. We say it's hip to hop the bus, because you can just hop on the bus without calling us a day in advance. So very convenient. You can get up in the morning and decide that you'd like to go shopping or get your prescription, or you may suddenly need to go up to Cheshire Medical Center, and you can get on the vehicle and get where you need to go.
Now, do you have any other services in addition to those two?
We actually have medical transportation, which is a new service within the last couple of years for us. Medical transportation, again, is an accessible vehicle that's going up to White River Junction and to Dartmouth Hitchcock in Lebanon. New Hampshire, on a Wednesday basis, on a weekly basis. And this is for people who have medical appointments up at those facilities. So it is, again, totally accessible, and people just need to call us a couple of days in advance so we can schedule and have enough room on the bus. But we leave her here early on Wednesday morning, take people up to their appointments, and then return them in the afternoon.
Now, I would guess, since you're going to White River Junction, Vermont, that part of that is to the VA hospital. So is a lot of your audience or ridership really folks that are maybe ex-military, retired, or maybe current military?
We do a lot of veteran transportation, both to White River Junction VA facility and here in Keene to the VA facility that's out on 101. But yes, most of our ridership is going to the VA for medical appointments. And I'd like to point out that sometimes people don't like to drive up and have a medical procedure and have to drive back, but they do need someone to go with them. It's stressful to drive, perhaps, for a spouse or an older friend. So indeed, they can bring a friend on the vehicle, and again, it's just a donation for that trip.
So with the Friendly Bus, is there a charge at all for people to ride the Friendly Bus?
It's a donation. We suggest $1 a ride, but people can ride for no charge if that's their circumstance. But we do appreciate any donation that people can give us for the Friendly Bus.
So you have transportation that's really providing for kids all the way through to senior citizens, veterans, people with that may be physically challenged and need rides. And it sounds like you're beginning to cover a little bit outside of the Keene area, getting out into Swansea. Now, are you going down into Hinsdale and Winchester or any of those locations?
We do go to Hinsdale and Winchester once a month as a group of very active seniors who like to go to the Hinsdale Friendly Meals. So once a month we do pick a group up and we enjoy lunch at the Hinsdale Friendly Meals and then come back. So it's a nice outing for the day.
So they actually have a social event.
Exactly.
What a great way to reduce isolation of our senior population and really have them connecting across the Monadnock region.
I think that's a great point, because many times a single car can be a very isolating experience, or if you're a senior and you no longer drive, it's a very isolating experience to be at home. But sometimes people just get on the Friendly Bus or the City Express to ride around and see the sights. And it's a great way to get out. And on the Friendly Bus and on the City Express, the driver is very friendly, like the name implies. And certainly on the City Express, there's a community of people who do ride every day and just enjoy each other's company and the opportunity to get out and see what's new in the city of Keene.
So I know one of the things that you're doing, Susan, is really collaborating with some other groups on transportation. Can you talk a little bit about that?
There's a number of efforts going on in the region and statewide about collaboration and trying to work on this very difficult and challenging problem. Transportation consistently shows up on surveys as one of the key barriers to people getting to medical appointments, or, as you said, to staying in their own home for as long as possible. And transportation has often been said it's the glue that keeps people together. So there's a number of different organizations, nonprofits, for-profits, that have gotten together around regional transportation coordination. And that spans from Peterborough all the way over to Hinsdale, organizations here in Keene that are trying to see how we can work together to better provide this transportation. Our medical transportation is a great example of what happened when we got together. There was a little bit of state funding to provide a new service in this area. The Red Cross, that provides volunteer transportation throughout the region, was finding that they were going many trips up 91 to White River Junction and to Lebanon. And we said, gee, if we took a bus, would that be a more cost-effective way to get people to that destination? So indeed, we are working very closely with the Red Cross. They take reservations, they refer people to us for the trip on Wednesday, and it is making it possible for accessible transportation. It's the first wheelchair transportation up to those facilities that we have had. So the Red Cross brings people in from outlying areas, and then we gather them together and bring them to White River Junction or, as I said, to Lebanon.
Wow, what a nice way to build a collaboration. When you think about, you know, we may have people coming in from Jaffrey or Dublin or lots of different locations, and to be able to come to one central location and then all board that bus together rather than, you know, 10 trips up in individual cars. Just from an, you know, an efficiency standpoint, but also from an economical standpoint. You know, a lot of folks are on fixed incomes, particularly the elderly, and to think that they can access this type of transportation and really reduce the costs, not only to them, but the cost to all of us, essentially.
I think that's another great point, because sometimes family caregivers need to take time off from work. And if it's a trip to Lebanon, it could be an entire day. So that's very costly to the caregiver, as well as maybe to the individual who's driving. And the Red Cross volunteers, if we have 2 or 3 trips running up to Lebanon every day, that's not a good use of anybody's time or the gas or the wear and tear on a car. So sending one vehicle up made a lot of sense. And we're working on various collaborations of that nature. If the Red Cross brings someone into Keene, we're glad to transport them around the city on the City Express, or get them where they need to go on the Friendly Bus, so that that driver can be freed up for those single trips that need to be made in our rural areas. And the buses that we have are used where there's 6 or more people needing to get where they need to go.
That was going to be one of my questions. You know, you have sort of 3 types of transportation you're providing through HCS, and how you really coordinate that and make decisions about the ridership and where it's most effectively, how people are most effectively served. So how do you manage that? Do you have someone managing that for HCS, or?
We do. We have a transportation manager and we have 2 dispatchers. So if you were to call for a ride on the Friendly Bus, one of our dispatchers would see where you were going and where you lived, where you were originating from, and might say to you, did you know that the City Express bus is going to stop at your location, at your home, and you can more easily get to Cheshire Medical Center or Riverside Plaza by taking the City Express, and tries to keep the Friendly Bus freed up for those people who are not within walking distance of the City Express and may need a little bit more help. So if somebody is going grocery shopping but they're living up near Robin Hood Park, then we would send the Friendly Bus, for instance, if they're an older person, to get them. But if somebody is living just down the road at Central Square, the most efficient way is to have somebody take the City Express.
Now, if somebody wanted to access the services, how would they contact HCS to be able to, you know, get that kind of guidance you're just talking about? Because I'm sure people are going to listen to this and they're going to say, oh my gosh, there's all this transportation and I don't know which one to take.
Exactly, exactly. People have lots of questions because people haven't taken public transportation in a while. We really are very wedded to our cars. The next generation isn't as wedded to their cars, but seniors did use the car. They were very used to just jumping in and going where they need to go. So what we have is a dispatcher on at all times, and people can access that by calling 352 8494, and one of our dispatchers will walk you through the process. So if it seems that the Friendly Bus is the service for you, we'll get some basic information on your first call, and then on subsequent calls, when you call in, we'll know exactly who you are, if you have an assistive device, what your needs might be, and we can very quickly schedule you for a ride. Sometimes people are just calling in to find out where they can get the City Express, and we might talk to them about getting to a bus stop, or they may live along a road where we can safely stop, and that's called a flag stop. So people can get on the bus at another location and get to their destination. And that's a very convenient way of getting downtown, say from Maple Avenue or Park Avenue.
You know, it's interesting that we live in a rural area and that we have public access to transportation like this. And it's exciting on one hand. On the other hand, funding seems so limited for this type of effort. And I don't know if you can speak to that at all and what's happening in the state of New Hampshire that supports this. Is there anything going on from the federal level? Because this is going to become more and more of a challenge. And you mentioned that young people tend to gravitate more towards the public transportation. And I actually know that for a fact because I have a daughter who, it was her first question when she was looking at colleges, do you have public transportation? I do not want to drive a car.
Yep, yep. Transportation, as we've said, is a very complex topic, and younger people indeed are gravitating to using public transportation, and vehicle miles driven by young people under 34 have actually dropped about 23% over the last few years. For seniors, that's the other demographic who really need transportation. And generally, about 1 in 5 people over 65 don't drive. Men, on average, after they get to about 80, will spend 7 years of their life not being able to drive. Women, about 10 years of their life not having a car. So it's really important that we tackle this issue. And there's a number of different groups, as you said, that are trying to look at this because the funding is coming from the federal government at this point, from the Federal Highway Administration. And that is the group that's funding the City Express. The state of New Hampshire, a couple of years ago, put in 32 cents per capita for transportation. We rank about 44th out of 47 in terms of state support for this activity. And last year, the state, though, because of the budget crisis, did not put any funding into transportation. We are very grateful, though, that the City of Keene has stepped up, and the matching funds that we need for the City Express are appropriated by the city as part of their budget process every single year. The Friendly Bus is funded by the Bureau of Elderly and Adult Services, and that funding has really been ratcheted back in the last few years. So that's why we're looking to the United Way to help us support this service and to donations, and we're really part of efforts like the Regional Coordinating Council to see how we all can be more efficient in making transportation work. The other group that's working on this is the MRTMA, the Monadnock Region Transportation Management Association, that's looking at how we can use transit, biking, and walking to get around the city.
And I know they've really done a lot of work here in the city with building bike paths and walking paths for people to utilize. It's just amazing, some of the system that's being integrated here. But at the same time, challenging. I want to remind our folks out there, when you do give, and you advocate for these types of things, it makes a real difference in people's lives. You know, Susan mentioned that 10,000 people rode the Friendly Bus. I don't know how many are riding the City Express. And
last year, 40,000 trips.
Yeah, so we're talking over 50,000 potential transportation services being provided here in the Monadnock region. And you know, when you give that dollar, and that investment makes a huge difference in people's lives and their access to service. And access just to daily living. You mentioned that. You know, who doesn't want to be able to go out and do their own grocery shopping? Well, maybe me, but I would love my husband to do it for me, but hey. But yes, you know, it seems so critical in the fact that we don't have within New Hampshire the resources really to support this right now. It's really incumbent on us here in the Monadnock region to take care of our own people.
It is. It's so, so important to be able to give that senior citizen the ability to get up to Cheshire Medical Center, to go get their prescriptions, to do their own grocery shopping. It's so key to independence. But I said earlier, about half of our ridership on the City Express is young people, and it's also critical for those folks with one car that the stay-at-home parent can take their child, again, to do those very same things, to get to a medical appointment, to bring a child to the rec center for a class, to go to Wheelock Park, to swim, maybe to come down with a bike to the skateboard park. All of our buses do have bike racks on the front, so we do have a number of families who load up the bikes on the bus and come down or go to Wheelock Park to enjoy some recreation. Very, very critical to families as well as our elders.
So if you had to say anything to our legislators or folks out here in the Monadnock region, what would it be about transportation that you'd want them to know?
Yeah, I think people see the bus and they don't see it as a critical part of people's lives. They don't see it as a way that people are staying in their homes and staying independent and really being part of an environmental movement as well as a long-term care and access issues.
That's such an important message, especially given that we live in a rural area, and that we have that young population who is tending to outmigrate right now from the region, primarily because they can't always access some of the services. If they live in outlying communities, it's very hard to get in for the social activities, for work even. When you think about access to work for people, you know, many of them are reliant on probably the public transportation system.
We do take people to work, and that's one of the things that people ask us, can we expand either our hours or to outlying areas? And that's where the work of the Monadnock Region Transportation Management Association is key, because they are looking at commuter systems. They're looking at how can we do more with carpooling in the good weather, using our bike paths to get people into work. Even if people could get to a bus stop as they're biking, we've put up shelters with bike racks so we can look at a multimodal system, a complete street system here that can move people throughout the city and move people from outlying areas in. I think we need to be very creative in how we address transportation going forward. If you have a neighbor who needs a medical appointment or a neighbor who doesn't drive, can you bring them into the city of Keene when you come into work, and can we provide transportation that circulates them through the city of Keene?
That's a great, another great concept to really think about how people could carpool and get to those central locations for that type of service. What do you see as the future role of HCS in all of this?
Well, HCS has been providing these transportation services since the early 70s, so we are very committed because it is so key to people's independence. But we're working with the RCC, we're working with the MRTMA, certainly to see what should the role of the city and other organizations be, because it's not a social service problem ultimately. It is a community issue. Public transportation is something that the community needs to look at and determine how public transportation fits into the community's future. The City of Keene long-term master plan certainly has reference to it, and we're actively working with the city to see how we might expand or maintain services with the city as a partner.
So if people wanted to get involved with really addressing the transportation issue in the Monadnock region, how would they do that?
They can call me, certainly. They can call Southwest Regional Planning Commission, and the staff there is working with the MRTMA, the Monadnock Region Transportation Management Association, as well as the regional coordinating efforts to pull all parties together and see how we can jointly address this.
So people could actually volunteer to really be a part of changing the system of transportation here in the Monadnock region.
We have actually many volunteers, people who are interested in this issue, coming together for our monthly meetings and giving their input. So in addition to looking at public transportation within the City of Keene, the Regional Planning Commission has been instrumental in looking at intercity transportation, like the Greyhound route that is going to Boston now. And again, it's all interconnected. People can take the City Express to the bus station and then the Greyhound service to Boston. And that's what we're looking at, is how can we all work together to put these pieces together for people. But it's really key that people support the system by taking a discretionary trip. It's so easy to just say, oh, I'm going to jump in my car and go downtown and pick up a greeting card, or I'll go get an ice cream cone or go to a movie. When indeed they might be able to take the City Express, not have as much pressure on the parking system downtown, enjoy the ride, enjoy meeting other people from the city on the bus, and then getting back home the same way, and not having to use their gas, not having to move their car out of their driveway.
You know, it's funny that you mention that, because in my previous position, I met an elderly woman who discovered through some of the work we were doing the bus system, the City Express and the Friendly Bus. She was able to use both and realized there was a way to sort of balance that, I think probably through conversations with your dispatchers there. But one of the things she said to me was she started taking the City Express just to be with other people and to be able to talk, and she just rode around town, had conversations with people, and would go back to her stop. Now, she had a car of her own, but, you know, again, it got back to that really being isolating. She really couldn't afford to run the car different places because she was on a fixed income. This allowed her to go out and be social, to stop at the places she needed to for the things she needed. So just a really nice service. So again, Susan, how would people contact HCS if they wanted to access some of these services?
They can call our dispatchers. 352-2253 is our main number, but 352-8494 is the number for the City Express and the Friendly Bus. We do have a lot of City Express and Friendly Bus information on our website, and we have a Facebook page for City Express, so that if a road is closed or in the bad weather we are making adjustments to the route, people can access us on Facebook.
Now, did we have any pictures or anything
We
that
did. I believe we did have some actual pictures of the services.
So while Rick is bringing those up for us, maybe you can kind of introduce what we're going to be showing here.
Yes, we'd like to actually show you the buses. And that is the Friendly Bus, and it's sponsored by Home Health Care, Hospice, and Community Services, a Monadnock United Way agency. We're located down on Marlborough Street. People can purchase tickets at our HCS office or on the bus. Oh, that is the City Express, and you can see our Hip to Hop the Bus frogs. There are 3 City Express buses, and again, they're all accessible, but people can just hop on and get to where they need to go along the route. showing our lift. If someone has an assistive device, whether it's a wheelchair or a walker, or someone can't make that first step on the bus, they can use the lift to access the service. We also have pull cords in the bus so that people can signal a driver that they'd like to stop. Oh, and there's some of our friendly bus people coming to the friendly meals. Seniors can access the senior center, friendly meals, shopping, medical appointments, wherever they need to go within the city of Keene. And as I mentioned, we're starting to reach out to other communities where there are 6 people or more that need to get to a destination here in Keene. Oh, that's a bike rack that we have on the front of the bus. And a lot of people use our bike racks. They might bike to work and then in the afternoon take the bus home, or they might bike to a bus stop and then take the bus the rest of the way. This shows our trip to Dartmouth Hitchcock Medical Center with one of our Sprinter vans. This is a very smooth riding vehicle for that long trip. And as I said, we have the Wednesday trip to Dartmouth and also to the VA at White River Junction, and we also go to the VA facility here in Keene. And again, just call us a day in advance for those services.
So now, is this service unique to the Monadnock region, this breadth of service, really?
There's no one else providing general public transportation in the city of Keene, certainly, or in the Monadnock region, other than some volunteer networks. And those volunteer networks are mainly in the outlying communities, and we work with them to try to see how we can give people more access. If they bring people into Keene, as I said, we'd be glad to circulate people to get them where they need to go.
Now, when you go up to White River Junction or up to Dartmouth, does the bus wait for people, or can they have outpatient surgery and then have a transportation home?
Yes. When we go to Dartmouth and to the VA, we bring people up and we actually wait for them. Thank goodness for cell phones, because we can hear when people are ready, but we drop off at the VA, then drop off at Dartmouth, and then come back to get people. But the vehicle stays up there, so when a person is ready, they can reboard the bus, and as soon as everyone is ready, we head back to Keene.
Now, is that accessible to anyone with a medical need, or just, it is?
Yes. The priority is for veterans and people over 60, but if there's room on the bus, we certainly do bring younger people. We've even had children with medical issues and their parents on to go to Dartmouth. And that's important because a person may not have the financial means to run a car up there, and they may want to focus their attention on their child post-procedure. So having someone else, a professional, do the driving is very important.
Really, really is. When I think about things, especially like outpatient surgery, where it's stressful enough, just the fact that you're going in for surgery and things, and to know that you don't have to worry about the transportation and parking and how you're going to get home after the procedure and do it safely. Such a nice service. Well, is there anything else you want to make sure our public's aware of, Susan?
Just call us, please. We are the friendly bus because we're a very friendly staff, and our goal is to help people to get where they need to go and provide them with independence. So again, call us at 352-8494. Visit the City Express on the web or our Facebook page for the latest of what's going on with transportation here in the Monadnock region.
And I want to recap for our audience that you have the friendly bus for those that are elderly or in special need, or have special needs and need transportation for daily living needs. You have the City Express that anyone can hop on and hop off with special rates this summer for all of you young people out there. And bulk rates, it sounds like, for people that maybe just want to use public transportation to get to work or other places. And then you have the medical transportation. So 3 incredibly valuable services for the Monadnock region. And, you know, as Susan mentioned, call them because they can perhaps help you find other transportation into a central location here in Keene so that you can access those services. So we invite you to ride the City Express, save on gas, you know, donate and give in any way that you can. I know you don't use volunteer drivers, but some of the other systems do. And just be aware that there's a lot of hard work going on here in the Monadnock region through the Regional Transportation Group and through a Regional Coordinating Committee to really make transportation efficient, reduce duplication, to really centralize and make it very accessible to the public. I want to thank you, Susan, for joining us. I want to thank you for joining us and invite you to remember to live united, give, volunteer, and advocate. Thanks for joining us.